So there's an under discussed, that's like, is a thing that is like easily being noticed in Tetralogy of Fallot, but people don't really give it attention when discussing Tetralogy of Fallot. So that's why I like picked it out to specially discuss it. Now this is squatting behavior in children with Tetralogy of Fallot. So you're trying to actually look at how it looks like. So the baby is squatting and is in distress. So we'll still discuss, apart from this squatting, what are the other things you notice in a child. Then we'll also be talking about why will a child having Tetralogy of Fallot be squatting. Do you understand? So let's establish, the linkage between this and Tetralogy of Fallot to be very solid. Now, just so you know, it's a classic. It's a compensatory behavior. So the child is trying to compensate for something. What is that? So you usually see that in Tetralogy of Fallot. So why do children squat? So children with Tetralogy of Fallot usually experience TET spells. That's episodes of what? Cyanosis. So if the skin is becoming blue, it just simply means the oxygen supply to that skin is not adequate again. Do you understand? So these spells are triggered by what? Right to left shunt. So deoxygenated blood is moving into what? The oxygenated blood, and they are moving into the system. Do you understand? So squatting increases systemic vascular resistance, which reduces the right to left shunt, forces more blood into pulmonary circulation. So more blood be going into lungs to be oxygenated by force. It improves oxygenation. So in essence, squatting helps to redirect blood to the lungs. Yes, that's why I see most children having Tetralogy of Fallot, they are squatting. This is cyanotic spells that we're talking about. So how does it look like? So children may instinctively squat after exertion if they are stressed. This thing is getting too much. They just squat and rest. So they may crouch with knees even, or even fall on their chest or sit down. Okay? So it's often seen in toddlers and younger children who are older enough to move independently, but yet not being able to talk about their symptoms. They can't be able to express to you how they are feeling. So it's something you see and observe. Do you understand? It's something you see and observe, and you have to save the child very quickly. This Tetralogy of Fallot, just to refresh your memory. All the defects. Thick ventricular wall, right ventricular wall, ventricular septal defects, okay, and the rest of them. So clinical significance. So squatting is one thing we look at, okay. So not only squatting, the child is squatted and you are seeing that the body is becoming bluish, the baby is distressed, the baby is crying, so of course by now you might have learned that what is the body's own way of trying to regulate blood flow. So that's just it. All right, and that's establishing the linkage between squatting in children that have Tetralogy of Fallot